Welcome back, guys, to Fastlane Sports Therapy. My name is Dr. Lane Tran, and today we are going over discogenic pain, degenerative disc disease, and end plate involvement in low back pain. So let's dive right into it. So here we have the low back. This is your lumbar spine. I took away a vertebral body that should be right here underneath this disc. This is a intervertebral disc, and then right below that is another intervertebral disc that I took out, so you can guys see the end plates. But diving right into it, so what is a intervertebral disc? So this right here, this whole structure is a disc. And essentially what's compared to oftentimes is a jelly-filled donut. So this part right here that's highlighted green is the dough part of the donut. And then this part of the green right here is the nucleus pulposus, and that's referred to as the jelly in the donut. So oftentimes we hear about a herniated disc, and that's when the jelly in the middle leaves that donut and goes out towards the nerve root, causing pain. But today we're talking about just discogenic pain. So what is discogenic pain? So discogenic pain is when you have tears in the dough portion of the donut. Now oftentimes it starts as circumferential tears, meaning tears that go along the circumference of this disc. And once you get multiple circumferential tears, it leads to a radial tear. And now a radial tear leads this nucleus pulposus, and it leads it away from the center of the disc. And that's problematic because the outer 1/3 of the disc is what is innervated by nerve cells. So you can only really feel pain when that inner third of that jelly starts herniating out and affecting those nerves on the outer third of the disc. Now, what this also causes is if you have micro trauma, repetitive trauma over time, from poor biomechanics when lifting, whether you're at the gym, lifting weights, gardening, or whatever it is that you're doing, this leads to degenerative disc disease. And degenerative disc disease is when you have micro trauma, repetitive loading with poor biomechanics, causing chronic irritation to the disc, and over time the disc degenerates. And essentially it loses the ability to hold fluids in the disc, allowing you to move properly without pain. And when that happens, that also affects end plates. So what are end plates? End plates right here is essentially the line of scrimmage between your intervertebral disc and the vertebral body. And what the end plates does is it allows nutrients to pass from the vertebral body into that disc. Now when you have degenerative changes to the disc, meaning that disc is losing that shape again because it's not able to hold fluids, it affects the end plates of the vertebral bodies. Now vertebral bodies have nerve fibers all over. So when the end plates have to change, it creates modic changes, where essentially the bodies of the vertebral bodies has to morphologically change to adapt to the stress. This will cause pain, chronic pain, especially in patients when there is modic changes in the vertebral bodies. So what things you can do about this is proper lifting mechanics, proper biomechanics, and making sure that you're seeing a healthcare professional if you're having chronic low back pain. This can definitely help you guys out. Next time we'll go into some exercises you guys can do for low back pain and more on what you can do to manage discogenic pain to make sure that you have a healthy, happy low back. Till next time, guys, and we'll find out more.